Now, if you're someone that is planning to have an upcoming knee replacement surgery, then you're going to want to watch until the end of this video. Today, I wanted to share with you 10 of the best exercises that you need to be doing to help ensure you build a strong and stable knee. Let's get started. Welcome back, guys. This is Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, when we're preparing for a knee surgery, as physical therapists, we do recommend prehab, which often we see people tend to have better outcomes because they're, one, already familiar with the exercises that they're going to be working on after surgery, and two, they already get a head start on some of the range of motion and some of the strengthening exercises that we will typically use for the knee. So we're going to get started with going over the 10 exercises, and the first 6 are going to be done laying down, and then the last 4 are going to be standing up because that's going to really start to facilitate and improve some of your standing balance as well as your walking. So the first couple ones are going to focus on flexibility, and we're going to start off by one of my favorites here, which is going to be a quadricep and hip flexor stretch. Okay, so if I'm stretching my left side here, I'm going to basically drop it down over the bed or the table here. And also now this is creating a nice good stretch through my hip as well as my quadricep. And then with the opposite leg, I'm going to bring it up towards my chest. I'm trying my best to keep my back down on the bed, nice and flat. And I'm feeling a nice good stretch all across the front of my thigh and even my knee. With all of these stretches, we can hold for about 30 to 60 seconds at a time, about 2 to 3 reps, and you're obviously going to be focusing on both legs when you do that there, okay? Next, we can move on to an adductor stretch, which is going to stretch the inside of your thigh. We know that these adductors actually cross the knee, so it can really affect the flexibility in your knees here. So your feet are gonna go together just like so, and laying on your back, you're gonna just allow the knees to kind of fall down to the side, and you're gonna feel a nice stretch on the inside of the thigh, maybe on the inside of the knee here. Once again, we can do for about 2 to 3 reps, and here we're gonna focus on 30 to 60 seconds at a time, just like that. Okay, next we're gonna focus on maintaining the flexibility in your hamstrings. The one leg's gonna go down flat on the bed, and the leg that you're stretching, you're going to basically support with your hands behind the knee here. And basically, we use this a lot with our sciatica patients, but also for anyone that's struggling with hamstring flexibility, and we kind of call this hamstring flossing. Here, you're gonna feel some pulling all the way down to the hamstring attachment, which is up here on the pelvis, and then all the way across the knee here. And so you can go for about a minute where you're kind of going up and down, and my toes are basically kind of going down as my leg comes down, but then as I come up, I'm kind of flexing my ankle and bringing my toes back up towards my nose, just like so. And you'll feel some stretching behind the leg there, okay? All right, so now we're gonna get into a few exercises that are gonna focus on strengthening the knee as well as the hips here, okay? We've all been familiar with a glute bridge. A glute bridge using 2 legs is gonna be great for stimulating a lot of the quadricep muscles as well as your glutes and your cores here. So you can bring those feet as far as you can underneath your knees, and you're just focusing on really bringing your hips up towards the ceiling, trying to get a nice good contraction of your glute muscles and your hamstrings, which is kind of bringing your hips up just like that. You'll hold for a few seconds at the top, and then you're gonna come back down. Once again, your hands can even go down at your side here. You're gonna raise your hips up, really feel your glute muscles and your hamstrings tightening, and then you're gonna come back down, and you can work on anywhere between 10 to 12 repetitions there. Now here we're gonna focus on our quadricep muscle. At this point, we know that anytime we keep that leg extended, we're really gonna force that quadricep to work efficiently there. So when you perform a straight leg raise, now you're gonna focus on holding that leg and then most importantly, controlling the descent on the way down. Okay, so we don't want to just kind of raise it too high. We really want to show control with each repetition. So you're coming up all the way about to the same height as this leg here, and then you're lowering down, and you'll start to feel that quadricep working because that leg will be shaking, and you'll perform about 10 to 12 repetitions as well with this exercise here, okay? Next, we're gonna move on to a hip strengthening exercise. And this is very important because we know that when we focus on any type of knee health with the surgery or knee pain, we definitely want to incorporate exercises for the glutes and the hips, primarily the hip abductors, which control a lot of the movement of the pelvis here. So we're going to call this a sideline hip abduction, and I'm going to keep that top leg straight as possible, and the foot's going to be slightly turned down. This creates an hip internal rotation, which is going to really allow me to isolate those smaller hip muscles there, okay? Also notice I'm staying on my side and I'm not allowing my body to rotate forward or rotate backwards. From this position here, you're going to raise that leg straight up to the side, and then you're going to bring it back down, and you're going to always show control on the way down. We don't want to just kind of go really quick. The slower that you can go and control that motion, the more effective this is going to be for you, okay? So we're really wanting to isolate those muscles. And with this one, once again, you can perform 10 to 12 repetitions at a time, and you should really feel the muscles of the back of the hip, especially the glutes here, working efficiently, okay? So now that we've provided you with a few exercises to help improve the flexibility and stability in your knee in a non-weight bearing position, now we can focus on progressing you to a standing position, which is really going to help you get more comfortable putting weight on the leg, as well as help with your walking and any type of dynamic activities here. So the next exercise we're going to get started with is the sit to stand, also known as the box squat. And you're going to do this on a chair or a box or even a bench that you have available at home or even at the gym. So you're going to start with your feet in a wide base of support versus not too narrow, so about hip width or even wider. And I also like kind of sitting at the edge of the surface that you're sitting on there, okay? So your feet are gonna be slightly turned outward, and now you're gonna weight shift your trunk forward, so you're taking your weight from your bottom over to your feet, and now you're gonna use your legs to drive yourself upward and then stand, and then lower yourself down slowly, okay? What I really want you to focus on is really feeling the quadriceps working and making sure that those muscles are controlling your way down. A lot of people perform this exercise and they kind of just plop and fall down, but really I want you to focus on, after you're standing up, allowing your hips to kind of sit backward and use your quadriceps to control that movement down. Normally, I can perform 10 to 12 repetitions at a time, and after multiple reps, if you do this slow enough with good control, you're gonna feel a lot of the quadriceps working, and this is gonna be one of the most fundamental exercises that you can implement, not just before, but also after surgery, okay? The best part about this is you can elevate this and scale this up, make this more challenging by using a weight in the front rack, maybe like a kettlebell or a dumbbell. You're simply going to hold it in front of your chest just like this, and you're going to do the same motion. You're going to kind of lean your body forward, use your leg drive to stand up at the top till your knees are fully straight, and then you're going to allow your hips to kind of drop back down, nice and control, and then come to a sitting position. All right, moving on to the next exercise, which is going to be a deficit heel raise or a calf raise. And this basically just means instead of doing this from the ground, we're gonna elevate your feet up a few inches, maybe on a step or maybe on a plate like I'm doing here. And this is primarily to feel a nice good stretch behind the calves and the knee. We know that the muscles of the back of the calf go across the knee, so it can greatly affect your knee health if those calves are so tight there, okay? So we're working on really raising up on those toes, feeling a nice good contraction of the calf muscles, but most importantly, you're gonna control the descent nice and slow and allow your body to kind of slowly feel the bottom of the stretch there, trying to keep your knees as straight as possible. you can work on about 10 to 12 repetitions at a time here, okay? Next, we're gonna move on to a single leg balance. Here we wanna make sure that you can appropriately carry your body weight on one leg without holding on to support. If you need to start off with one hand support, you can use the wall or the counter to balance yourself just like so. Our goal here is working on 10 to 15 seconds on each side, and we're always reminding you to train both sides so that you build enough stability in the hip and the knee and feel comfortable with this balance exercise just like that, okay? Now the last exercise we're gonna go over is probably one of my favorites to help build hip stability and knee stability there. We're gonna focus on the three-way hip, okay? Now I like doing this holding on to a wall or a counter or something that is quite sturdy here. And I'm gonna actually be working my left side here, okay? So I'm gonna get a nice good stance on with most of the weight primarily distributed in my right foot. And I'm gonna focus on first flexing the hip forward, and I'm gonna go through about 10 repetitions where I'm moving the leg in a forward direction, okay? I'm trying to keep my hips nice and leveled as possible. I'm not kind of leaning back or really leaning forward or letting the leg bend. I really try my best to keep the leg straight there, okay? Now we've gone forward direction. Now we're gonna go laterally, and holding on for support prevents me from really kind of cheating. If the balance is difficult, this is where something else supporting you can come into place. So we'll work on laterally, keeping the leg straight. Once again, trying to keep our hips stable without doing too much trunk lean to the side, okay? The last position is now gonna be behind us. So we've gone forward, we've gone to the outside, and to finish up this three-way exercise, now we're going behind us. With this specific movement here, we don't expect a lot of range of motion with that hip extension. It is a harder movement for people. If you force it, you'll feel your whole body kind of lean forward. You'll see people doing this sort of motion, but really I would prefer less range of motion, but more control, really isolating those hip muscles and those glute muscles when you're working on this. And once again, 10 to 12 repetitions on each side there, okay? Now there you have it. Those are the 10 best exercises that you need to be working on before surgery to help ensure you build a strong and stable knee. Now, if you want more information on how to build strength and longevity with your body, please consider subscribing to the channel, and I'll see you in the next one.